Welcome to Diplomatic Channel. I am Amarachi Ubani. This week, Nigeria will be declared free of Ebola by the World Health Organization. That declaration will tell the whole world that indeed we have contained the world's most deadly virus, at least for now. However, the WHO and the World Bank have been urging Nigeria not to rest on her oars. The fact that Ebola still exists in 3 countries in West Africa means that protection could be punctured if she's not alert. They're also urging us to help those countries to fight the disease. The number of the dead has been steadily rising, unfortunately, right now heading towards the 5,000 mark. Outside of the country, the Spanish nurse that became the first person to contract the virus outside of West Africa was on Sunday said to be now testing negative for the virus. Doctors say they had emphasized that a second test would be needed before she can confidently say that she's no longer suffering from the virus. Worse than the virus is the fear of the virus itself, which has spread even faster than the Ebola virus. Doctors say Ebola has infected people's psyche more than it has affected their bodies. Over in the U.S., questions are still being asked how the virus is contracted and if the U.S. could be experiencing a different strain from what's experienced in West Africa. And those questions are still mind-boggling to medical experts, but here's what they can tell us, that some people infected with Ebola never get sick at all. Those who become sick shed massive amounts of the virus and others don't. And then with Ebola, one may or may not get a fever. They say the virus is mutating and could change its mode of transmission. So Ebola has really become a global problem. Or as the Liberian President Ellen Johnson Sirleaf put it in her letter to the world, nations have a stake in the fight against Ebola.
Mrs. Johnson Sirleaf's message indicated the fight against Ebola should not be left to West Africa alone. With nearly 5,000 people killed by the disease, even international organizations are reaching out to the West for help. So far, 9,000 people have been known to have been affected by the virus in Liberia, Guinea, and Sierra Leone. The Liberian president has urged commitment from every nation that has the capacity to help, whether with emergency funds, medical supplies, or clinical expertise. Other countries in West Africa that have had a stint of the virus, Nigeria for one, has been declared Ebola-free by the World Health Organization. Making the announcement in the federal capital city, Abuja, the WHO described the feat as a spectacular success story.
Today, 20th of October, 42 days, it means twice of the incubation period. After the last confirmed case of Ebola virus disease was discharged from the isolation ward, having tested negative for the Ebola virus, the chains of transmission have been broken. This is a spectacular success story that shows to the world that Ebola can be contained. But we must be clear that we only won a battle. The war will only end when West Africa is also declared free of Ebola.
This risk and the risk to other countries can only be eliminated through the setting up of a system similar to the Nigerian one under the leadership of the United Nations, but with the operational wing built around ECOWAS.
So there will be simultaneous transmission.
While AIDS organizations are complaining that donations have not been enough to deal with the crisis, foreign ministers from across the European Union gathered in Luxembourg on Monday to discuss what the British Foreign Minister Philip Hammond has described as a major health crisis.
We do need this €1 billion fund. There is a major health crisis here. We've got a very short window to get on top of it and prevent the uncontrollable spread of this disease. This is a very worthwhile investment, and that money would be spent on providing additional beds and isolation facilities in country, because the only way we're going to stop the spread of the disease is to make sure that people are isolated and treated early.
The foreign ministers aim to agree on an EU approach to medical evaluation that will reassure international healthcare workers they would receive high-quality care if they caught Ebola while working in West Africa. Under the proposed strategy, health workers who had not yet developed full-blown Ebola symptoms will be evacuated by commercial air ambulance. If doctors advised against travel, patients could receive treatment in Africa.
Thank you, Minister Counselor.
Meanwhile, China has donated $6 million to the World Food Programme to help alleviate food shortages in Liberia, Guinea, and Sierra Leone. China has sent hundreds of aid workers to Africa to help in the fight against the Ebola outbreak and more than $35 million in medical aid to the worst-affected countries.
The World Food Programme and the people of West Africa are especially thankful for this contribution of $6 million from the People's Republic of China at this very difficult time when we need to reverse Ebola's advance. This substantial, and I stress to the members of the press here, timely contribution to the World Food Programme will be divided equally between the three countries, enabling the World Food Programme to purchase vital supplies, mainly rice, lentils, and yellow peas, and blended fortified cereals. These will form emergency rations for more than 300,000 people for 1 month, as well as specialized nutrition products to help prevent malnutrition, especially in the very young.
China's trade with Africa increased from $10 billion in 2000 to an estimated $200 billion in 2013, 4 years after it overtook the United States as the continent's largest partner. On the other hand, the African Union has pointed out that there is a severe lack of medical personnel and treatment facilities to cope with the outbreak in West Africa. The AU says Guinea, Liberia, and Sierra Leone need hospitals and treatment centers and well-trained doctors and nurses.
We have to do more as the continent to mobilize human resources. We have about 100 volunteers. Up to now, we are looking for more. Volunteers because that is going to be a big challenge to augment the human resources that exist in the three countries.
The AU has established a special team, African Union Support to Ebola in West Africa, to cope with matters related to the epidemic. So far, the team has received funding commitments totaling $35 million. It has also petitioned member states asking each of them to send 10 to 20 volunteers to the three countries. Regarding the issues of border closures and bans on travel to the affected countries, Dr. Zuma said the situation is expected to change in the near future.
Not just ministers, but some announced at the UN that in a few weeks they'll be opening their borders, so we're going to be monitoring that. When we talked to some of them, they said, well, they didn't have measures in place to take care should a case arise, but now they have put measures in place. They think they can lift the ban.
And as for the Spanish nurse who became the first case outside of West Africa, her husband, who has been hospitalized in an isolation unit as a precaution during her illness, has blamed the hospital for what he called their lousy handling of the Ebola crisis.